Cognitive behavior therapy was recommended for this client. It is essential for me to establish a rapport with him and build his trust. He grew up in a very unstable environment with no one to really care for him. He does seem to have problems with adults and authority figures, so it would be very important for me to be consistent, patient, and empathetic with him. To start, I will educate the client about his diagnosis and what CBT is, so that he's aware of everything that's going on and what it will look like moving forward. We will go over goals and what he hopes to accomplish in therapy, so we're on the same page. We will work on identifying his core beliefs by applying the downward arrow technique, so we can both gain a better understanding of his behaviors and any problematic schemas he may have. To aid the client in discovering any problematic schemas he may have, we will utilize the Young Schema Questionnaire. Treatment for the client will include teaching him different ways to help him challenge his problematic schemas and manage his negative thoughts, such as he is unlovable and he cannot trust anybody but himself. To challenge these thoughts, we will use cognitive restructuring so he can gain a new perspective on his current situation. I will teach the client effective coping skills like relaxation techniques and journaling to identify his negative thought patterns and to look at the evidence and the facts and to reconstruct more positive thought patterns. I think it's important to teach the client more effective communication and social skills that he can use in his everyday life, especially in anger-provoking situations. I will utilize modeling and role-play scenarios to help him with effective communication and what it can look like and how to manage his anger in the moment by deep breathing or taking a few moments to collect his thoughts by stepping back. To increase his self-worth, it is beneficial for me to focus on his strengths and to reframe his thinking pattern about himself. I will reinforce him every time he does say positive things about himself, teach him how to manage and challenge his own thinking patterns, and encourage him to start using positive affirmations every day. The client is also endorsing some symptoms of PTSD from the trauma he has experienced and is experiencing. Eventually in our session, we will start to use prolonged exposure therapy, which could assist him in gradually approaching his trauma-related memories, situations, and emotions he has. Prolonged exposure therapy can be used to help him stop avoiding trauma reminders and aid him in processing the traumatic events. I am concerned that it would be difficult for him to respond effectively to exposure therapy, considering his age. So I would move forward with different routes that would work better for him, like art therapy, so he can better express and understand the trauma that he went through and is going through and the emotions that are connected to it.